Hello there, I'm Stephen Bunting and I'm an MSK physiotherapist working in the northwest of England. If you're new to the channel and want to know a bit more about me and why I'm making these videos, then I'll put a link up here, or you can see the video description below. This video is all about trigger digits, more commonly known as trigger finger or trigger thumb. Before we get started though, please note that this video is for information only and is intended for people who've already been diagnosed with trigger digits by a healthcare professional, or for people who are maybe just interested in learning a bit more about the condition in general. So if you think you have the condition but you haven't been diagnosed, please get checked out professionally first. Okay, so with that done, let's get cracking with trigger digits. As with my other MSK videos, I'll be tackling the condition by answering the 3 most common questions asked by patients, and I've put timestamps to the relevant sections if you want to skip around. So question 1, what is it? And within that we'll discuss the typical symptoms. Question 2, why have I got it? And question 3, what can I do about it? What are the treatment options? Okay, so on to question 1, what is a trigger digit? Well, first, let's discuss the typical symptoms, and then I'll explain what causes them. So classically, a person with triggering will say that their finger or thumb will occasionally stick when they bend it. It most commonly occurs first thing in the morning, and they might wake up with their finger or thumb locked into their palm. Sometimes it will suddenly snap back out again when they try to straighten it, or they might have to straighten it with their other hand, and it will release suddenly. It can sometimes be quite painful when it straightens out suddenly like this, and they'll commonly feel a click or a pop in the finger. It's this sudden unlocking or triggering of the finger that gives the condition its common name. If it worsens, it can start happening more frequently throughout the day, and can eventually happen every time the finger is bent. A note of caution here though, because if you have the condition, and if your finger ever locks completely, so you're absolutely unable to straighten it, and if this lasts for more than a few days, then you'll need to see a healthcare professional as soon as possible. Fingers left like this will stiffen up very quickly, and it can take a long time to recover their movement, and sometimes they'll never fully straighten their finger despite lots of hard work with the physios. So the main message here is that if you have a locked trigger finger or thumb that you can't straighten anymore, then you need quick treatment, usually an injection, and if that doesn't help within a week or so, then surgery. So don't delay in getting seen. So those are the symptoms. Now let's discuss what's happening to cause them. Well, the condition is essentially a mechanical problem involving one of the tendons in the affected digit. It's commonly called trigger finger, but it's also very common in the thumb. In fact, in order of occurrence, it most commonly affects the ring finger, followed by the thumb, and then the middle finger, the little finger, and least of all, the index finger. It's also more common in the dominant hand. So in order to understand what's happening in a trigger digit, we first need to understand some of the basic anatomy. Let's take the middle finger as an example. So as you can see, we have a series of joints that can each move in order to allow the finger to bend. What causes the bending movement is the flexor tendon, which runs alongside the palm side of the finger. It is controlled by the muscles in the forearm, which pull the tendon and cause the finger to bend. Now the tendon is anchored to the joints by a series of pulleys, of which there are 5 main ones, which we call the A1, A2, A3, A4 and A5 pulleys. Without these pulleys, the tendon would take the shortest route and would bowstring when pulled by the muscle. The pulleys stop this from happening and allow the finger to bend smoothly. At least that's what should happen in a normal finger. Occasionally, a small swollen nodule can develop on the tendon which stops it from gliding smoothly through the pulleys and causes the classical triggering. When bending the finger, the nodule will push up against the pulley, but because the flexor tendon is so strong, it will usually be forced through, but then get stuck on the other side. So that's what causes the finger to stick in a bent position. It almost always occurs at the A1 pulley, which is located just here in the palm. And if you have a feel around, you might notice a tender nodule on the affected finger or thumb when compared to your other fingers. This ultrasound scan shows what finger triggering actually looks like. Here we can see the flexor tendon, the underlying finger bones, and the A1 pulley that appears as a dark area just above the tendon. Here we can see the tendon moving, and here is the tendon nodule coming into view. The nodule pushes up against the A1 pulley and eventually is forced through as the finger triggers. Here is the nodule on the other side of the pulley. Now let's see that again in real time. Although the problem area is located here at the A1 pulley, you'll tend to notice the triggering when you move the middle joint of the finger, which we call the PIP joint, because this joint causes the most relative movement of the flexor tendon compared to the other finger joints. The other scenario we sometimes see is where the nodule is too large to enter the A1 pulley in the first place, and therefore the finger won't bend properly. This usually occurs as a progression of the typical symptoms, so you might have experienced the usual triggering, but then one day you notice that the finger won't bend properly anymore. The triggering therefore stops, but you can't bend the finger. This is another type of locked finger, and you should get it seen quickly to avoid long-term finger stiffness. Okay, so that's what causes a trigger finger, or to use its proper name, stenosing tenosynovitis. So let's move on to question 2. Why have I got it? Well, the first thing to say is that trigger digits are a common condition. Studies report a prevalence of between 2 and 3% in the general population. The condition has nothing to do with osteoarthritis or other degenerative conditions. It's just a simple mechanical problem caused by localized tendon swelling. We know it's more common in women over 50. It's also more common in people with jobs or hobbies involving repetitive finger movements. It's also much more common in diabetics, where the prevalence rate increases to around 10% of the diabetic population. People with inflammatory arthritis, such as rheumatoid arthritis, gout, or thyroid disease also have a higher risk of developing the condition. Other than that though, we don't really know what causes the tendon nodules to occur, but thankfully it's an easy condition to treat and get better, which leads us on to question 3. What can I do about it? Well, if your finger or thumb is triggering fairly typically like we discussed earlier, meaning that it's not locked and you're still able to bend and straighten it out, even if just for a while, and with some pain, then the chances are that it will usually respond to non-surgical treatment. The usual self-help remedy is to apply anti-inflammatory gel to the area around the tendon nodule on the palm. It's best applied around 4 times daily, with the last application being just before going to bed. Anti-inflammatory tablets can also be used, but for either the gel or the tablets, please consult a pharmacist or other prescribing clinician first, as not everyone can use them. The other treatment worth trying is a night splint. Something like this, which keeps the affected digit straight at night, can prevent that classic morning triggering and help rest the tendon and encourage normal healing. I'll put a link to a suitable splint in the description below. Research suggests that around 60% of people who use a night splint for around 6 weeks will get better. So it's always worth trying this simple regime as a first-line treatment. The next stage is a cortisone injection, and so you'll need to see a healthcare professional. A single injection can be highly effective in quickly curing the problem, and this can be repeated 6 weeks later if it's only partially effective. 1 or 2 injections have an 80 to 90% success rate in curing the condition. In diabetics, the results are around 60 to 70%, so overall, injections are a highly effective treatment for most trigger digits. Finally, if your trigger finger or thumb hasn't responded to the usual treatment, then surgery may be considered. The procedure is quick and simple and usually done under a local anaesthetic. It's also highly effective, with a reported 99% success rate. The surgeon simply cuts the A1 pulley, and this allows the tendon with its nodule to move freely again. Some surgeons will do the procedure using a needle tip as a scalpel to cut through the pulley, which has the advantage of needing no incision and therefore no scar and a quicker recovery. With surgery, people often ask if their finger will work normally when the pulley is cut. Well, It seems that in the vast majority of cases, the finger seems to be able to work perfectly well without the A1 pulley, as it still has the remaining 4 pulleys to fall back on. Overall, trigger finger release is a fairly low risk procedure, but as with all surgery, there are potential risks and complications, and you'll need to discuss this with a hand surgeon. Okay, well that's it. I hope you found the video helpful. Please feel free to comment below, but please be aware that I can't give any personal advice. Thanks very much for watching, and bye for now.